So I think we're going to get started now. It's 7:03. So first of all, I'd like to thank you for joining us today for our first Facebook Live. I think it's our first Facebook Live that we've ever done at OCL Vision. My name is Masara Laginaf. I'm a consultant ophthalmic surgeon, so I specialise in cornea, cataract and refractive surgery. We've got a new member now, James has just joined us. So I'm a specialist in refractive surgery, so I help people get rid of spectacles and contact lenses, and I also specialise in cataract surgery. So today we will be talking about lens replacement and cataract surgery. And some of you may be interested in one or the other, but there is a lot of overlap between the surgeries, so hopefully we will cover something for everyone. And please feel free to comment in the comment section below, and I will answer any questions that you have. So I've been at OCL Vision now for over 2.5 years, and it's a wonderful place with wonderful people. We are a consultant founded clinic. We have 3 clinics now, 2 across London, 1 in New Cavendish Street, just off Harley Street, 1 in High Street, Kensington. And we also have 1 state-of-the-art clinic and theatre in Elstree, Hertfordshire. So we're able to deliver our care a little bit outside of London as well. I'm personally based in central London, at New Cavendish Street and in Elstree in Hertfordshire. The beauty and the kind of uniqueness of OCL is that we are consultant or clinician founded and led, so we are very driven by patient-centred care. We recently won the Best Healthcare Outcomes Award at Lang Boosen Awards last year, which is really an accolade and an amazing achievement for the clinic, which I think highlights our level of excellence and patient-centred care that we delivered. We really focus on outcomes. We really focus on providing a bespoke and personalised service. And we have a series of benefits to coming to OCL Vision. So we have things like a drop-a-drop app where we help our patients stay on track of their drops. We have options of finance. We have 13 consultants across multiple subspecialties, and we offer the latest state-of-the-art technology. And we often have early access to the most advanced lens types as well. So what we're going to cover today is we'll cover everything from what to expect in the surgery, what kind of symptoms may present with cataract, what types of lens options we have, and how we may be able to assist you with the best lens for your own individual lifestyle. Just to cover a little bit about insurance, for cataract surgery we do accept most insurance companies, so Vitality, Bupa, AXA, Alliance, WPA and Aviva. And I'm happy to answer any questions on that later. So I'm just going to move on now to understanding what kind of vision changes you may experience when you develop cataract or as you age. So the first thing that patients often say to me is in the early stages with cataract, they may notice blurring of vision all the time, so in the daytime and the nighttime, but sometimes it's just a very slow and gradual blurring of vision that may present initially just in the evenings or when night driving. And the reason for that is that cataract is a clouding of the lens inside the eye, and that blocks a little bit of the light that we have in our surroundings. And therefore, we often first notice symptoms at nighttime or with reduced lighting. Patients may also experience glare or starburst with driving at night, and that can be quite debilitating. And so before your daytime vision is affected, you might find that you're struggling at nighttime. Other things you may see are yellowing of colours, but as it happens over time, you may not be entirely aware. It's often after the cataract surgery that you do notice how vivid and bright colours truly are. The other thing you might experience is frequent prescription changes. So if you're finding that you're going to the optician maybe a couple of times a year, and each time your prescription is changing, that might be a sign of cataract. It is something that can be easily detected by your local optician. And so if you were to go for an eye test, that's the type of thing they would detect. And we would be very happy to see you at any stage of cataract development. It doesn't have to be until the cataract is what we call ripe or particularly severe. If you notice those early changes, it's often worthwhile getting an opinion to maximise and optimise your vision as much as possible. So what is the difference between cataract surgery and lens replacement surgery? Well, with cataract surgery, what we're doing is removing a cloudy lens. It's about a 15-minute operation. We use a technique called modern microincisional phacoemulsification or cataract surgery. And essentially what we're doing is making a tiny 2mm keyhole opening in the outer aspect of the eye, we're removing the cloudy lens with an ultrasound probe, and we are placing a new lens inside the eye. And that lens is a permanent, typically acrylic lens, which should last you a lifetime. Now, the difference between cataract surgery and lens replacement in terms of the surgery, so from a surgical perspective, it's very much the same type of operation. However, with lens replacement surgery, there is often no cataract, or there is a clear lens. And the reason somebody may want to have lens replacement surgery is to remove their need for glasses. Now, the onset of what we call presbyopia, which is a reduction in near focus or reading vision, typically happens in your early to mid 40s, and that can vary from person to person. But when you develop that natural stiffening of the lens in your 40s, your ability to focus on objects closer to you becomes more difficult. And you may want to have your lens removed and a new lens placed in the eye as a permanent procedure to both correct your distance vision and your near vision. And that's the beauty of doing lens replacement surgery earlier. So I just wanted to touch on that briefly. I'm going to do a poll now. We're going to give it a go. So we're going to make this a little bit interactive, and I'm just going to try and launch this now. So the first question is, what is your biggest concern about surgery? So I'm going to launch this poll now, see if technology is going to work for us tonight. Give that another go. So the options are, actually, we're going to change that. We're going to launch a different poll. We're going to launch a poll which is asking, what is your biggest struggle with your vision right now? So for those of you joining us, is it your difficulty seeing up close? Is it you struggling with night driving? Is it that everything has become more blurred generally? Or is it that you don't like wearing glasses or contact lenses? So I have attempted to launch the poll. We'll give it one more go. Oh, here we go. We've got some answers already. We've got one vote for struggling with night driving. We've got someone where everything looks blurry. Let's have a look here. Thank you for answering. So we've got 2 votes in. I hope we can get a few more. Some of you might not have any of these problems right now. You're just interested to understand what we offer. So I think that's going to be open for about a minute. Somebody who hates wearing glasses, don't blame you. I was exactly the same until I had my eyes lasered a couple of years ago. So we've got 2 votes for I hate wearing glasses. You're in the right place. Struggling with night driving, we've got 1. Everything looking blurry, we've got 1. So if everything is looking blurry and you've had your vision corrected with glasses, it's highly likely that if everything else is okay with your eye, it's likely that you have developed cataract. Night driving, again, it could be cataracts. We've got more I hate glasses now. We've got 3 votes. So while we're waiting for that to finish, I'm just going to touch on why you might have developed cataracts. Now, most cataracts are age-related, so it's something that happens as we get older. There are some other risk factors, so significant UV exposure over your lifetime will, lead to cataract. Certain dietary or lifestyle factors like smoking or drinking excessive alcohol, certain medications like steroids. So if you're on, lots of courses of oral or IV steroids, that could accelerate cataract formation. Conditions like diabetes, trauma to your eyes. If you've had a blunt trauma to the eye, that could increase the cataract formation risk. Other things include genetic conditions, which may predispose you to cataracts at an earlier age. So at OCL Vision, we do see patients of all ages who develop cataracts. I think the youngest I've treated at OCL is someone in their 30s up until patient in their hundreds. So it does vary massively from patient to patient. So I think our results are in, and the most common reason, the most common struggle for people right now was that they hate wearing glasses. A few of you struggle with night driving, and a few of you are struggling with everything looking blurry. So thank you for doing that poll with me. So I'm going to talk a little bit about the surgical process, and if there's anything I've missed, feel free to comment in the section below, because I can see that some of you have just joined us. So please feel free to comment in the comment section, and I will answer any questions you have at the end of the talk. So what to expect from the surgery. So I touched a little bit on how we do cataract and lens replacement surgery, but it's a very straightforward, routine procedure. It takes about 15 minutes per eye. We do offer bilateral same-day surgery depending on the patient. Not everyone is suitable for that, but the majority are. And that means you have both eyes operated on the same day. With the surgery, you're normally lying down on a comfortable reclining chair. You have a microscope above the eye, and that microscope has a few lights within it. You don't see anything coming towards your eye during the procedure. The bright lights tend to move throughout the surgery, and often my patients describe it as a light show, and some even describe it as psychedelic. Some have even described it as enjoyable. Your eye is completely numbed during the surgery, so you don't feel any pain throughout the procedure. You may feel occasional pressure or water on the eye, but generally patients are always surprised at how straightforward and comfortable they are during the surgery. In terms of anaesthetic or sedation, we offer a light conscious sedation, an intravenous sedation, and that is administered by one of our very experienced anaesthetists. That tends to keep you very comfortable, very relaxed. It doesn't send you to sleep completely, so you will be awake during the procedure, but you will be deeply relaxed. The alternative is an oral sedation, which is a mild sedative tablet to take the edge off, as I like to call it. Not quite as powerful as the intravenous sedation, but does help. And some patients who are very relaxed and are very happy with undergoing eye surgery may just opt to have a simple local anaesthetic, which again is fine. We always leave the final decision up to the patient, but we do advise you based on our findings in clinic what we think would suit you best. We don't offer a general anaesthesia at OCL Vision, but it's very rare that a patient would need that. And so intravenous sedation is the most popular option. In terms of the recovery, most patients find their vision pretty good on day one. You do go home with a shield over your eye. You can take that off when you get home. You will find the vision on the day of the surgery a little bit blurry. You might be slightly light sensitive. Your eye might be slightly watery or gritty, but generally patients find it quite comfortable on the day of the surgery. The following day, your vision is pretty good. Most of my patients, I will touch base with them the following day just to check how they are getting on. And most patients find that their distance vision, depending on what you've opted for in terms of your lenses, but most patients find their distance vision pretty good on day one. The near vision, again, depending on what type of lens you've opted for, does usually take another 24 hours or so to pick up. So that can take another maybe 2 days post-op before you're starting to enjoy good near vision. But that does vary from patient to patient. In terms of the ability to return to driving, typically that's 3 to 4 days. I have had patients who've gone back to driving quicker depending on their recovery. So it really depends on how you find it and how your vision is post-operatively, but typically it's 3 to 4 days. Returning to work, again, is around 3 to 4 days. It depends on what you do, but generally most people can resume screen work within 48 to 72 hours. In terms of the kind of sports and things like that, or physical activity, we normally say 2 weeks for heavy lifting, bending, straining, or anything excessively active. Gentle walking, all that kind of stuff you can do pretty much straight away. Swimming underwater is around 4 weeks. So there's a few limitations, but generally patients are always surprised at how quickly they can return to their normal everyday life. And the recovery is normally fairly smooth. In terms of your post-operative visits, it depends on what you need, but generally speaking, most patients are seen at 2 weeks post-operatively to check the vision, to check that everything is healing as expected, and to check that the pressure is normal, the retina is fine. So we do a full thorough examination, not only as part of your initial assessment, but also part of your post-operative visit. Depending on what you need after that, we are very flexible in terms of our aftercare, and we will see you as much as required to ensure that everything is healed as needed. Typically, we will then discharge you back to your optician, your local optician, once things are settled. So we're going to do another poll. Okay, so this is the one that I was going to do earlier. So what is your biggest struggle? Oh no, we're going to go back, different one. What is your biggest concern about the surgery? that was it. So I think I already launched that and I got 1 vote. So the biggest concerns, so questions were cost of treatment, complications or risks, pain during the procedure, and long recovery time. So we had 1 vote for complications or risks. And so I can briefly touch on that. Cataract surgery and lens replacement surgery are generally very safe. The one thing we always say is that with any surgical procedure, nothing is without risk completely. But generally, these are very routine, standard surgeries with over 99% of patients having no issues. There is a small risk to the vision. Generally, what will be quoted in most ophthalmic centres and in the NHS is that the risk to the vision is typically around 1 in 2,000. At OCL Vision, we've done over 10,000 lens implants and we've, touch wood, never had any of these significant sight-threatening complications, including infection. So our infection rate, we're very proud to say, is 0%. Other things to be aware of are things that you would expect with any procedure, so inflammation in the eye, changes in pressure, which we will monitor for, and these things can be normally be well managed with drops. The eyes can get a little bit dry after surgery, and so we always optimize you before the operation with lubricating eye drops and dry eye measures, and then we give you more lubricating drops and dry eye measures after the surgery to ensure that your eyes are comfortable and your vision is as good as it can be. Other things I mentioned to patients is, depends on what you want to achieve. If you are having surgery to get rid of spectacles completely, we need to target 0 prescription. So you want to be on target as best as we can be. And the beauty of OCL Vision is that if for some reason you don't land exactly on the target and you want to fine tune the outcome or fine tune your vision, the beauty is that we have access to laser vision correction. So we are also laser eye surgeons. And a lot of centres don't necessarily have access to that technology. And the beauty of this is that we can fine tune your results 3 to 6 months after the surgery, once your eyes are settled and stable. And that means getting you out of glasses. Enhancement rates are quite low, about 1 in 100 may need an enhancement, and that's a very straightforward procedure. About 1 in 5 patients might need something called a YAG laser. That's when we clean away any thickening or clouding in the capsule behind the lens. And the capsule is essentially the wrapper or scaffolding that holds the lens in place. It's very common after lens surgery to get a little bit of clouding in that capsule. About 1 in 4 to 1 in 5 patients may need a YAG laser, and that is something we offer at OCL Vision as well. And it's a very straightforward thing to do in clinic. It just takes 2 minutes and it's completely painless. So these are some of the things we talked to you about before the surgery, and we have a very detailed consent form process where we run through all the risks in detail. So there is, I'm just looking through my notes because I have to keep myself on track. I wanted to share a patient success story actually about someone who was very nervous about surgery. This was a 59-year-old lady still working, and she developed quite a dense cataract over the COVID period. So she was in lockdown, found it difficult to get to her optician, and started to notice her vision deteriorating, but due to anxiety, fear and the lockdown, didn't actually access any help until 3 years later. By the time I saw her, her left eye had perception of light vision, so she was only able to see light out of the eye. The other eye was not too bad, still kind of borderline for driving, but nowhere near as bad as the left eye. So we made a plan to do the left eye first. We took additional precautions because it was a very dense cataract, so we had to do additional measurements for her. Often with very dense cataracts, we can't fully measure the eye in clinic. So we ended up doing ultrasound scans, which we have access to via Marie, who is our in-house physicist and expert scanner. Again, we're very lucky to have her at OCL Vision. So we're able to do additional measurements for the patient. We gave an IV sedation and a deeper anesthetic around the eye to make it more comfortable for her because she was extra nervous and it was an extra dense cataract. After a 20-minute operation, she instantly saw the results, the difference between the pre-op and post-op results, and she was ecstatic, and she actually ended up having better than 20/20 vision in that eye. We went on to do the second eye about a month later, once the first eye had settled, and she ended up having a brilliant outcome. She also ended up being spectacle independent because we opted for a premium advanced lens that allowed her a range of vision. So that's just a really nice story about how someone's anxiety can lead to a worsening of a condition, but actually with the right care and the right attention, you can still have a really good outcome. So we're just going to quickly touch on, I can see some questions coming in, thank you. We're just going to quickly touch on choosing the right lens for your lifestyle. So you may know that there are different types of intraocular lens implants that we can give you. And it can get a little bit complicated when we talk through these lens types because there's quite a few different types and they have different names. So what we try to do in clinic is your surgeon will assess your eye, will do detailed scans, will examine your eye in detail, and then we'll talk you through our findings and also what lens we think would best suit you. So we always want you to come in with an idea of what level of spectacle independence you want to have. So you might be someone in your 60s, perhaps you've been wearing varifocal glasses for 20 odd years, you're very comfortable in those glasses, you're happy with your vision in those glasses, and you're also used to maybe the way that you look in those glasses, and you're quite keen to stay in them. So we will then go through the options with you. And for example, you might want to have a monofocal lens, which is a high quality single vision lens. And this is the most common type of lens implant typically used in the NHS and also used in the private sector. But this lens will give you very good vision at one specific chosen distance. So if you wear varifocals and you want to have very good distance vision without glasses, we can implant a monofocal lens targeting distance vision correction. So when you don't have any glasses on, your distance vision is excellent. However, when you look at something up close like your watch or your phone, that would be slightly more blurred. In that case, you would wear varifocals to bring that into focus, or a pair of reading glasses. And many patients are very happy in monofocal lenses because it provides excellent quality of vision. So that's option one, and that's what a lot of patients do go for. The next option is something called a premium monofocal or enhanced monofocal. And this is something that we implant a lot because this gives you the quality of vision of a monofocal, but also gives you a little bit of intermediate vision as well. And by intermediate vision, I mean kind of that 80 centimeter range, 60 to 80 centimeters. Now it varies from patient to patient. Some patients do get a little bit more intermediate vision, so they can see the dashboard, they can see the computer with these lenses. And some patients may not get as much, so it does vary from patient to patient. But this is a nice option where you may not want to implant something too complex, but you want to give the patient a little bit more oomph so that they can see a little bit more intermediately as well. The beauty of monofocals and enhanced monofocals is they have very few downsides, they have very few compromises. So if you are someone who has other eye conditions like a retinal condition, glaucoma, you can safely put these lenses in because they're not going to impact on the quality of vision. And they also tend to cause less halos or night vision complaints or problems. Some of the more advanced lenses can cause halos around lights, which for most people is fine, but for some people they prefer to avoid that type of phenomenon, and then we have these lenses as a great solution. Moving on to what we call extended depth of focus or extended range of vision lenses. This is again a very good distance quality vision, but it also gives you very good intermediate vision, so your computer screen. And it gives you some near vision as what I describe as large print near vision or social near vision. So that could be the larger print that you may read on a menu, for example, in a restaurant, but you might not be able to see the small text in a book or in a newspaper. And again, the beauty of an extended depth of focus lens is that you're not getting so many side effects. You might get mild haloing around lights, but it is quite mild and very well tolerated. What we can do with extended depth of focus lenses is we can target one eye for distance and one eye for near, and we call that blended vision. And so we sometimes use extended depth of focus lenses to actually give you a range of vision by offsetting one eye slightly short-sighted. And so we can play around with the lenses to give you what you want depending on your preference, and that's something we do quite a lot. The final lens I'm going to touch on is something called a multifocal lens or a trifocal lens, kind of the same thing. And what these lenses do is the lens has a series of concentric circles within the lens. So it's like having a lens with multiple powers within it. And those multiple powers allow you to see distance, intermediate and near vision. So it gives you a full range of vision. And I always tell my patients it gives you near vision at around 35 to 40 centimeters. So it doesn't give you anything up here, but it does give you that normal reading vision distance. These lenses are very sophisticated. They're not suitable for everyone. And so when we see you in clinic, if you're very keen to be spectacle independent, we will assess whether you are a suitable candidate. We will also counsel you on the potential compromises of this lens design. The main compromise is that the lens has circles within it, or rings, and those rings do split light. So 90% of the light in the room will get to the back of your eye, not 100%. That can mean that when you're in a dim setting, you may want to wear a pair of reading glasses or put on a bright light, but not everyone needs to do this. It's just something that you may need to do. And the other thing is, typically with these lenses, you will see more halos around lights, and that can be more prominent when you're night driving. So if you're someone who does a lot of night driving, or you drive for a living at night, you may not want to have a lens of that design. But there's a lot of very happy patients with multifocal lenses who are willing to compromise and over the first few months adapt really well to the new lens. And so that's a really good option for some patients who want to be spectacle independent. We do have a new lens, which we were actually one of the first people in the UK to implant the lens. It's called the Galaxy lens by Rayner. And it's a kind of new generation. So it's not quite a multifocal, but it does contain a central spiral design within the optic. And this is a very exciting lens because it doesn't lose any light, and it creates that full range of vision that you want if you want to be spectacle free, with less halos than a multifocal. So there are some new lenses coming out that are almost like the next wave or the next generation of the traditional multifocal. And the Galaxy lens is something that we've started implanting at OCL Vision with excellent results. And it's a lens that I'm using a lot at the moment. So I think what's great, I think the takeaway points are there's loads of options. We will help guide you to the right option based on what you want and what is suitable for you. And we are at the cutting edge of what's available. So you will always have access to the most cutting edge technology when you come to OCL Vision. I've got a few questions coming in. I think I'm actually going to go to the questions now. So I am going to scroll through and see what we have here. Please feel free to comment in the comment section if there's anything I forgot to talk about. I'm sure there's plenty that I haven't quite touched on, so please feel free to ask me and I will try to cover it this evening. So we have some questions that have come in. Mark Dalgarno, that's terrible, I should know how to say that. Prior to the surgery, is there anything I need to do or prepare? Okay, well, let's start with prior to your appointment. So prior to your initial assessment, there are certain things I would personally like you to do. So if you're a lady, I would like you not to come with too much makeup on, and I would like you to have your eyes well lubricated. Because when we see you in your first appointment, we're going to do a series of scans. And those scans are going to assess the shape and contour of your eye. And we use those calculations to actually calculate the power of your lens, those scans. And the more accurate those scans are at your first visit, the more accurate your lens choice is going to be. And therefore, the more accurate your refractive outcome is going to be. So I always say to my patients, if you are coming for an appointment, if you are known to have dry eye or blepharitis or any issues with the eyes, try to make sure they're in a good condition when you come for your initial assessment. And you can do that by using over-the-counter preservative-free artificial tears, applying hot compresses, taking omega-3 every day. So there are a lot of things you can do at home before you come just to ensure that your eyes are in a good position for your initial assessment. Not essential, but I would very much like that myself. Prior to the surgery, yes, it's very similar. So we want you to be in good health. So if you have any health conditions or any problems, we always make a note of that prior to the surgery. If you have any active infections, if you're on antibiotics, you need to let us know because we would want to defer the surgery. We want your eyes to be in a good condition. So again, we want your eyes to be well moisturized, well lubricated. So we will typically give you lubricating eye drops to use prior to the surgery. And these are typically 3 to 4 times a day in the run up to your procedure, just to ensure your eyes are ready for the procedure and that they're going to be comfortable post-operatively. We also like the eyelashes to be clean, so avoiding too much makeup in those few days prior to the surgery, ensuring that you keep your eyelids clean. You can use lid wipes or cold boiled water in a cotton pad, and applying hot compresses, again, if your eyes are dry. All of these things will put your eye in a good position. The other thing we do is we ask you to download our app. We will actually download it with you on the day if you haven't downloaded it, and we'll run through how to use that app because that will keep you on track with your post-operative drops. hopefully I've answered that. So will both eyes be treated on the same day? For lens replacement surgery, so if you were doing the surgery specifically to get out of glasses or contact lenses, I often find that having both eyes operated on the same day is very convenient. It allows your brain to neuroadapt quicker to the new lenses because both eyes are working together. If you have a very high prescription like -7, for example, and we do one eye and then we stagger the other eye, we can do it that way. But what you might find is in those interim weeks that your eyes feel a bit uncomfortable, you feel a bit unbalanced, and so actually doing the eyes together does make sense in that regard. And so for the majority of patients for lens replacement, we will offer to do surgery on both eyes on the same day. And the statistics have shown that the safety profile and the outcomes are similar between same-day surgery and staggering the surgeries. For cataract surgery, it really depends on your cataract, your general health. For some patients, if they have one really bad cataract in one eye, moderate or mild in the other, they may only want us to do one eye, the bad eye first. They may just want that additional bit of time to recover before having the other eye done. The other thing I want to talk about briefly is if you've had previous laser eye surgery or corneal refractive surgery like radial keratotomy. So some people have had surgery many years ago to get out of glasses, and now they want to have their lenses done, whether that's lens replacement or cataract surgery. For those patients, we can do both eyes on the same day, but some surgeons, depending on their preference, will advise you to have one eye done and then the second eye done on a separate day. The reason for this is that the refractive outcomes, or the outcome that we achieve, is less reliable if you've had previous laser eye surgery. Now, we have additional calculations and we take great measures at OCL Vision, and we're laser eye surgeons ourselves, so we have a lot of experience in this field. But we will do additional measurements and calculations to ensure we're as accurate as possible. But by doing one eye first, assessing the outcome, and then doing the second eye, it's just improving the chances for success. And those are some of the circumstances where we may stagger the surgeries. So I hope that was clear. Do all the clinics offer cataract treatment? So yes, we have a theatre in every single site. It's a very high-tech theatre. We're able to do lens surgery, cataract surgery, plastic surgery, all sorts of different procedures within our theatres. And we have a theatre at each site, so you can have your surgery in Elstree in Hertfordshire if you live more north of the city. We also have a theatre in New Cavendish Street, and we have one in Kensington. So depending on your preference and what works for you, we recommend you choose one of the sites that is most convenient. So, and that's the beauty of OCL Vision, is that we have that variety of locations, and hopefully we'll have more in the future. So moving on, I'm going to answer the next question, which is how often do I need to attend the clinic for aftercare appointments? So I think I touched on that briefly. Typically, your first appointment is around 2 weeks post-op, and it really depends on your preference. So most patients will have their follow-up at the clinic they've had their surgery, but if you need to have your surgery on a specific day somewhere, we can arrange your follow-up at a different clinic if that works better for you. So we typically see you at 2 weeks, and then we leave it open. So some patients are doing very well at 2 weeks. Vision is excellent, healing really well. And then we will discharge you to your local optician to be seen again, normally around 6 to 8 weeks post-op. If for some reason you want to come back to see us, or we feel we need to see you again just to monitor things a little bit more closely, then we can arrange that for you. So there is no set fixed structure in terms of when we have to see you, but definitely that first 2 week check is really important. We also have, availability. If you have any issues or want to come a little bit sooner, we can always accommodate that if needed. You mentioned medication. If I own blood thinners, would I still be suitable for surgery? Very good question. Thank you, Mark. Yes, so blood thinners are not so much of an issue with lens surgery because, as I said, it's a very minor, very minimally invasive procedure. There is not a significant amount of blood loss like there is with a hip replacement. So with this type of surgery, you just continue your blood thinner as normal. You don't have to change anything. If you are on warfarin, there is for those of you who are, there is an INR level that's measured every so often. And we normally recommend that you have that checked in the run up to your surgery so that your INR level is in the normal range for you. but generally speaking, it's not a problem. So a lot of our patients are on aspirin, warfarin, clopidogrel, and it's absolutely fine. How many follow-ups will I get? Will I see the surgeon? So at OCL Vision, we have an open door policy. So we are patient-centered in the way that we approach our care. If our patient needs to come for any issues in the first week, we will accommodate that. Where possible, if you need to see your surgeon, we will arrange that for you. If it's a routine follow-up, then we will arrange that with our expert optometrist. So we work very closely with our optometrists. They are very experienced and they do the majority of our follow-ups. But if there's a specific issue where you need to see your consultant or you feel there is a specific need, we will always try to accommodate that as best as possible, just to ensure that you have the care that you need. And how many follow-ups will I get? Again, it depends on what you need. For lens replacement, we include in the price surgery for, follow-ups for up to 1 year, which very few patients need, to be honest. Most patients are discharged within weeks, if not months. And generally, if there's any problems, you can always get in contact with us in the future. So I think we may be all out of questions. So if anyone has any burning questions, please feel free to ask me. For any more information, you can go to our website, oclvision.com, I believe. I should definitely know that. Let me just double check that is indeed our web address. And we have all sorts of information there. So we have information on pricing, different lens types. We have information on our different surgeons, so you can choose who you may wish to see. We also have information about our different locations as well. So very happy to answer any more questions. I think we might be out of questions now. Yeah, if you have any queries at all, you can contact OCL Vision on 020-3369-2020, option 1 for new patients, option 2 for our current patients. You can email me directly if you like, if you have any burning questions for me. It's masara@oclvision.com. And as I said, please visit our website. There are links to book a consultation or to inquire if you're interested in potentially having cataract or lens replacement surgery. And yeah, I hope that was a useful session. And if there's anything else that you want to ask, you've got maybe a minute left. I think we're all done. So thank you very much for attending this, our first Facebook Live actually. And I hope that was useful, and hopefully we'll have plenty more of these events and we can interact and answer any questions you have in future. And look forward to seeing you at OCL Vision soon. Take care and good night.